Testing is one of the key tools used to help identify the virus and then possibly slowing the spread when you can identify it and stay away from others. But when should you get tested, and how can you tell the difference between COVID-19 and other illnesses? WRG's Alex Coleman has the diagnosis from Mid-South health experts.
As the Omicron variant continues to spread throughout the Mid-South and the rest of the country, the demand at testing sites and for at-home testing is on the rise.
We know that testing across the country is so hard to come by at this point, and you'll stand in line or wait in line for hours to get your test.
Any sign of a symptom, such as a sniffle or cough, could have you worried you've contracted the virus. But COVID-19, the common cold, seasonal allergies, and the flu can cause many similar symptoms. So how can you tell what you have?
And we don't have very much influenza at all. So really, if you're having symptoms of anything that are outside of your normal, allergy symptoms that you might have, which are more rare in the winter, then you probably have COVID.
Infectious disease specialists say it's important to understand the differences in symptoms, such as how the illnesses can spread, how they're treated and prevented, and when to get tested.
Much more important to go get tested and be careful who you're around if you're having respiratory symptoms right now. If you have alteration of taste and smell, you almost certainly have COVID. That's not common except for the nasal stuffiness itself with a common cold or even the flu.
But one place you shouldn't go to be tested is hospital emergency rooms. They are already stretched thin with COVID patients.
Do not go to the ER to get tested if you're having mild symptoms. Make sure that you go to one of our several community testing sites or call your provider to see if they are doing testing.
If you do have any symptoms, the best advice is to stay home.
And you should probably just stay in quarantine. And then if, convenient testing is available to you, then go and do that and take advantage of that.
So let's protect the people around us who are still going to get sick. It may not be you, but it may be your loved one or a person you care about in some way.
Alex Coleman, WREG-TV, News Channel 3.
The Centers for Disease Control encourages people who have come in close contact with someone with COVID to get tested at least 5 days after that contact was made.